So in the B-cell lymphoma world, the cardiotoxicity monitoring is a challenge. There are two examples. One is, probably we know for a while, the cardiotoxicity from anthracyclines in some of the chemo backbones, such as R-CHOP, ABVD for large cell lymphoma and Hodgkin lymphoma, respectively. We know to screen for any cardiovascular comorbidities before giving those drugs, but in a perfectly healthy patient with no cardiovascular comorbidity, how to monitor the reduced ejection fraction, for example, can be a challenge. In patients with Hodgkin's, usually they are younger when they're diagnosed and getting treatment. So we do have, sort of better established survivorship practice in those patients, screening for second malignancy, screening for heart failures and with echocardiograms. For large cell lymphoma, I think that remains a challenge to routinely screen for that. So, and also we do not have good patient or disease characteristics or biomarkers to predict who are the folks who are more likely to develop heart failure. So that continues to be a challenge. In the more recent years, I think the arrhythmias such as atrial fibrillation or sometimes rarely ventricular arrhythmias with BTK inhibitors are emerging as very important side effects to BTK inhibitors, for example. So again, the challenge is to how to identify patients who may develop atrial fibrillation down the road, because the absolute risk is not that high, probably 5 to 10%, depending on which agents and how long the follow-up is. So more research needs to be done how to identify those patients, and then based on the risk, how to closely monitor for such events. At Mayo, we collaborated with some of our cardio-oncology colleagues, where we look using artificial intelligence to look at the prior EKGs up to 10 years before treatment of BTK inhibitor, try to look for some clues or markers that may predict a higher risk of atrial fibrillation. So we do need studies like these to help us in the future to identify patients who are more at risk, so that we can manage these patients expectantly and with close monitoring as well.